Hi, and welcome to the Cutting Edge Vet Podcast hosted by Dr. Terry Fossum, and we're having our guest today, Dr. Rainier Ko. Dr. Fossum, would you mind sharing a little background of Dr. Ko?
Yeah, hi, it's my pleasure. So first, let me start by saying today we're talking about epilepsy. It's a cause of seizures in dogs and cats. So if you have a pet that has seizures or you have a friend that has a pet that has seizures, today's podcast is for you. So Dr. Ko is a great person. You guys are going to enjoy him. He graduated from veterinary school at the University of Montreal in 2000. He has divided his time between academics and private practice. One of the very unique things about Dr. Ko is that he got boarded as a surgeon initially, and then he went on and did neurology and got boarded as a neurosurgeon. So he is double boarded, and there are only seven
There's seven of me
so
today. Yeah.
seven people in the world who has both those board certifications. So he's very special. You guys are going to love hearing what he has to say. So let's talk about, just tell us about seizures in dogs and cats. Like, how common is that?
Absolutely. First of all, thank you for having me. And every time you talk about my credentials, it makes me blush. I feel like you're talking about somebody else. But that being said, let's talk about seizures and epilepsy and how common it is. And so, unfortunately, it's very common. In fact, as a neurologist, it is by far the most common chronic neurologic condition that I deal with. It takes up most of my day in phone calls and most of my appointments. And just to give you an idea of perspective, it's estimated that 1%, so anywhere between 0.75 to 1% of the canine population has epilepsy.
Wow.
Right?
Wow.
So let's do some simple math, and maybe math comes easier to me because I'm Asian by origin, but simple head math, right? So how much? There's 90 million approximately dogs that are registered in the US of A, divided over 65 million households. So rough back of the napkin math would say that approximately you have 1 million dogs nationwide that has seizures or epilepsy.
Wow.
Right?
Wow.
To a lesser extent, cats, but let's not treat cats as second-class citizens. I don't do that. So,
And we don't treat them as small dogs.
No, we do not. They're absolutely not small dogs. But that being said, yeah, so it's a big problem. It's a big deal. And from there, I think what's really important for the audience to know is that, what is a seizure, right? So as we embark on trying to figure out how best to help these pets, it's really important to define what the problem is. And so a seizure, to get into the weeds, it's not that important, but scientifically speaking, it's a sudden explosive depolarization of electrical activity in the brain, right? And so it's almost like if you have a computer, it's all of a sudden short circuits with an extra surge of energy. And with that comes the outward manifestation of a seizure, which could be an abnormal involuntary contraction of your body, so paddling or convulsing. It could be an abnormal sensory world. You might be seeing things that aren't there. In fact, one of my friends from New York, a good friend of mine, she actually lives in Boulder, Colorado, and she's a long time and childhood epileptic. She said her seizures were, she would experience what the color blue would taste like.
Wow.
Right? And it's amazing because, in her world, that's exactly how it felt and what it seemed. And I have no comprehension of what that is. But just to show you that seizures can be almost anything in terms of abnormal experience that comes from the brain. So that's a seizure by definition. And yes, both cats and dogs and many, many, many species get seizures, right? And then you brought up, hey, epilepsy, right? So pets have epilepsy. And epilepsy, by definition, just so that we get the groundwork straight, epilepsy is seizures that are recurrent of any cause, right? So if you have multiple seizures in your lifetime, no matter what's causing it, that's called epilepsy.
Even if it's a medical like to say you happen to be taking medicines causing you seizure. That would you're still in that.
Yeah, and that's important to say. But the reason why I'm even bringing this up is when you go on different websites or Dr. Google, it's almost implied that epilepsy, that term, is referring to the genetic disorder that's so prevalent amongst dogs and cats, right? So in any case, and most of the time when we'll be talking about epilepsy today, we'll be talking about that form of epilepsy that's most prevalent. The ones that is probably heritable in origin, that there's no brain tumor or stroke or trauma that's causing.
Okay, so that let me just stress that. So when we say that a dog or a cat is epileptic, does that mean that you've worked them up and you've determined that there's no identifiable cause, like they don't have a brain tumor, they don't have anything obvious, and so then you would call them an epileptic? Or
Yeah, that's a perfect way of defining it. So, as seizures are a symptom, it's like saying, "Hey Terry, you just coughed," right? Cough is not a disease. You cough because either you have allergies and maybe you're a smoker, or maybe you have tuberculosis, right? Same way, if you have a seizure, that's a symptom of a problem of the brain. There are three main causes, big causes of seizures and epilepsy, right? So there are problems with the brain itself. You can have meningitis, you can have a brain tumor or a stroke. You can have problems with the rest of your body that affects your brain. So say, in a person, you're an alcoholic, therefore you have liver disease or liver failure.
cirrhosis.
Cirrhosis, yeah. And so that affects your brain and causes seizures, right? But the third main category is exactly what you said. To define a dog or a pet with this third form of epilepsy, basically you have to do all the tests that say there's no other disease that you can detect before you can say, you know what, it's probably a heritable genetic origin.
Okay. Yeah.
So I have to ask the question. I'm sorry, I have to ask the question. What's cirrhosis? As the non-science person on this call, can you explain that to the audience a little bit more, please?
Sure. So cirrhosis is the end stage of a liver after being affected by any particular disease, right? So cirrhosis is the same as saying liver failure.
Yep. And there's, just to add on to that, I mean, there are lots of different causes. There's alcoholic liver disease. There's non-alcoholic fatty liver disease, which is a huge problem in people. So there are many different causes that can essentially cause your liver to stop functioning normally. And the point is that is one of the causes that can cause you to seizure, because you're not processing a lot of the metabolic waste in your liver that you normally would. And then those substances get in your bloodstream and cross into your brain and can cause seizures. So, yeah. So, okay. So we've defined what epilepsy is and what seizures in general are. What would you tell a pet owner that has a dog or a cat that is seizuring? Is there anything when that's happening at their home that they should do to keep the dog or cat from harming themselves, or is there anything they can do to lessen the frequency or the severity of the seizure?
Yeah, and this is such an important question, because if ever any of you have ever witnessed a seizure, it's dramatic, right? In no uncertain terms, it can be extremely scary to see that. First, you won't even know what's going on. And when it happens, I think the most important thing to start thinking about is, first of all, most seizures, take a deep breath. Most seizures are self-limiting. The average seizure in a dog or cat lasts 90 seconds. Okay. And although in most people, most pet parents, I'm sure that feels like 90 hours. 90 seconds is usually how long it lasts. Okay, a little shorter or a little longer. And whilst it's happening, one of the hallmarks of seizures is the pet is not in pain. All right. Although it looks like an exorcism or something very dramatic, it's very important to know that these pets are not in pain. Okay.
That's important.
Yeah. From there, though, once a seizure starts, there's very little you can do to actually stop it from running its course, right? So however long it takes, the most important thing is, number one, just make sure that the pet is in a safe environment, right? So that would include staying away from stairs, staying away from sharp edges or objects or furniture.
Maybe watch them if they're on the bed so they don't fall off.
Absolutely. Or, here in Arizona, we got to be careful, when our dog's near the edge of a pool.
Yeah.
Well,
Oh, yeah.
So that's all very, very important. From there too, there are other things that we have to consider. There are a lot of myths and fallacies. You often hear about, trying to shove a cloth in their mouth or anything like that. Don't do that. You're going to get bit, and by no way, shape, or form does that actually help the patient that's having the seizure. Dogs and cats, unlike people, cannot swallow their own tongue, right? So don't try to grab onto the tongue and pull on it or anything like that.
Okay.
And during the flailing, dramatic convulsions that's happening, be careful. You can injure yourself, or you can actually injure your pet too by over-restraining. So
trying to hold them down and all that, just let them work through it on their own is the best thing you do in a safe environment.
Absolutely. Yeah. And so that's what I would recommend. And certainly I think another part that's less intuitive is that it's going to be important that you document what's happening. And it's very hard to think of this in the moment. But if you have the wherewithal, video record it.
Oh, great idea.
Yeah, because that information, how it's happening, how long it's lasting, the nature of the whole event will be super insightful for your veterinary healthcare team to then use that information to define, was it truly a seizure or was it a lookalike? Because there are cross-stressors of seizures as well too.
Such as
an example would be fainting, or otherwise known as syncope, right? So if you have heart disease and you have a dog that was out playing, sometimes when you pass out, you've seen videos of these where people tremor a little bit whilst they're on the ground. Mm-hmm. That could be misdiagnosed as a seizure.
Okay.
Say, for example, say a pet has a herniated disc in their neck. So they have a slip disc, a pinched nerve.
Right.
That could look like a sudden contraction of involuntary movements or whatnot. Here's another great example. Did you know that most seizures actually occur while you're sleeping? Right? It's true in people, it's true in dogs, it's true in cats. And the reason being, it's cited that it's probably because as you're going through your sleep-wake cycle, your brain activity is changing. And during those changes, it might promote a seizure to happen in a dog or a cat that was susceptible anyways, right? Yeah. So we hear that a lot. But we all have pets that dream or act out their dreams, right?
They paddle.
They paddle.
We call them puppy dreams. Yeah.
So how would you distinguish that, from, say, a real seizure? I would immediately wake them up. Wake up your pet. And if your pet wakes up out of it and says, "What'd you do that for?" That's not a seizure.
I was having a great dream. Thank you.
Yeah. You can't distract a pet out of a seizure.
Okay.
Right.
So that's how you tell. I love that.
Yep. Yeah. Yep. So
just gently try to wake him up. Don't scare him. Try to wake him up.
So that being said, getting back to, the importance of video recording, if at all possible, that's going to be super important and helpful information for the veterinary healthcare team.
Great. That is a great tip. Talk to us, Rain, about the workup. So I bring up, let me back up. I told everybody at the beginning of this that you're boarded in neurology and you're boarded in surgery. I'm guessing we have a lot of people out there that's like, what do you mean you're boarded? Talk about the extra training that goes on to qualify as a boarded neurologist or a boarded surgeon, and then to do both is really amazing.
Yeah, I'd be happy to. So just to give you the lay of the land when it comes to becoming a veterinarian here, typically in the United States or in Canada where I'm from, there's usually an undergrad degree followed by veterinary school. It's usually a 4-year program or whatnot. From there, you can go out and practice in the state or province that you're licensed in. But some people, like you and I, decided to do higher training So that includes doing a year of an intensive internship, followed by then choosing a particular specialization within veterinary medicine. And that could be surgery, ophthalmology, cardiology, neurology, dermatology. Basically, all of the specialties that you think of when you think of human medicine, all of those apply really to veterinary medicine. And so in order to become a specialist, you go through an intense residency training program that could be 3-4 years long. After that, you pass a big credentialing board exam, and then you can call yourself boarded, right? So you're boarded, meaning you are
board certified.
Board certified, yeah. So you're a specialist in a particular field.
And so he did that first in surgery, and then he went back and did it in neurology. So he's really a glutton for punishment. But we need people with that skill set. So tell us about, okay, I bring my dog in. My dog's had his first seizure. It lasted 90 seconds, was scary. What is the workup? What should I think about the workup is going to be on this pet? And if you can, I know the cost varies depending on where you are. So if you guys out there, you probably know, depending where you live, you're going to see different veterinary charges, but give us an idea of what people should expect.
Sure. So, if my pet had a seizure, and of course I would go in to see my veterinarian, and from there, I would absolutely mandate that a certain number of tests should happen, right? So let's rule out a possible cause. The simplest way to do that is to check the body using blood work, right? That's a very, very simple thing and not too expensive, usually to the tune of roughly around $500 or whatnot. And you can rule out things like low blood sugar, anemia, things like liver failure, kidney failure, and whatnot. So these are simple things that can rule out potential causes of the seizure, right? From there, though, it gets a little bit trickier to figure out, well, because certain diseases that affect the brain don't show up in the blood, probably the best way to then assess the status of the brain is to submit my pet to, say, an MRI. Right? So most people know what an MRI is, and so it's the same type of technology that's used within our pet population, where we're taking pictures of the brain, and we're looking for things like brain tumors, which is much more common in older pets, things like meningitis. Here in Arizona, we have an infection called valley fever that is prevalent and rampant, and this type of fungal disease that affects people as well too can get into the brain and cause infections. And on top of that, we can also look for things like strokes or traumas and whatnot. And we do the same type of testing in people as we do in dogs, where we can do a spinal tap. So we're actually drawing fluid from around the brain, sampling it, and seeing if there's inflammation or infection in there. So these are tests that can help define the cause. And there's no better treatment for epilepsy and seizures than to treat the actual cause of what's causing it, as opposed to just relying on medication.
Yeah, absolutely. If there's something treatable, you would want to do that. So I'm sidetracking us here a bit, but because we mentioned brain tumors, talk about brain tumors. I mean, how often do you actually treat those in dogs or cats, and what's the success rate?
Sure thing. Yeah, Sean, did you want to jump in and say something?
I just wanted to ask a very brief question. If you were to do the blood work, how fast after the seizure occurs do you need to get that blood work sample before, or is there a timeline that you need to be within to make that work?
Yeah, no, not necessarily. I would say that usually the testing is done pretty soon after the seizure, only because the seizure just happened, and then by happenstances, the real gateway is how soon can you get in to see your veterinarian, right?
Yes.
But let's say, for example, it's due to liver failure. Well, if you're in liver failure, whether you do it the day of the seizure or a week later, it'll still be there. The difference is, say, the pet got into a toxin, right? So if you get into a toxin, that one's going to be a little bit trickier to sort out, because a toxin usually affects you quite soon after exposure. from there on in, you may not see any of the lab work changes further on as the toxin wears off.
I see. Thank you.
Yep. And so that might be a one and done kind of scenario where they got into something, they seizure one time, and then they don't seizure again. That would be the hope. So brain tumors, what types?
Yeah. So brain tumors, you can almost categorize brain tumors as being of two flavors, right? And so there's a type of tumor that starts in the brain, and that's where it grows. And as it grows there, just its space occupying effect causes more and more problems, depending on where within the brain it's actually located. The second category of brain tumors are those that are actually a metastasis. So they are a spread of a cancer that is elsewhere in the body. And unfortunately, when you look through the studies and you go off basic experience as a veterinarian, brain tumors are very common. They're much more common than we hope. They're common in people. You think of the late Senator McCain. I mean, he had glioblastoma multiforme.
Yeah.
Dogs certainly get that. The older you are, the more likely you develop these. And certain breeds are more predisposed as well. You'd be shocked to hear that golden retrievers and boxers can be the two highest represented breeds.
I actually would not be shocked about that at all, because that's true of most tumors, unfortunately. For boxer lovers out there, and I love boxers, think they're awesome dogs. We call them tumor making machines because they do get a lot of different tumors. Okay, so if your dog is diagnosed, let's say with a glioblastoma, so it's got a primary brain tumor, I'm assuming for the Mets, there's not much you're going to do. Maybe treat the primary and maybe some chemo, but probably not going to do much else. Steroids might help, right?
Yeah.
Initially, because what Dr. Coates said, which I think is really important, is understand that part of the issue with tumors in the brain is that because we have a hard skull, tumors can't grow out typically, so they're going to go in and they're going to put pressure on your brain tissue, and that is obviously a problem. And so anything you can do to sort of decrease the inflammation and maybe shrink the tumor, you may see an improvement of signs. Yeah. Not for a long time probably, but short term.
Absolutely. So when it comes to symptomatically treating a tumor, essentially what you said is absolutely correct. Sometimes a tumor actually measures, say, the size of a golf ball. Let's say it was 1 inch in diameter. But within the brain, oftentimes there's inflammation around the tumor, which makes it feel like it's 2 inches in diameter. So one of the things you can do is give an anti-inflammatory, such as a steroid like prednisone. And fortunately, that drug, once ingested, gets through into the brain and actually can decrease the swelling, so to speak, and can actually buy time for the pet. So that would be an important way. And of course, if it's in the right location, so all seizures are generated in the front part of the brain. So if you have a tumor in the front part of your brain, you may have seizures, and so treating those seizures symptomatically would also be a part of the management.
Got it. Interesting. Okay, so let's say, so the term that we use when we can't find an underlying cause for diseases, we call it idiopathic, which really means we just don't know what the cause is. In my mind, that's how I was thinking of idiopathic. It's like we just don't know. So if you have a case of idiopathic epilepsy, tell me how you would treat that. What drugs do you use? Is there anything new on the horizon?
Sure. So I think when it comes to idiopathic epilepsy, which absolutely you're correct, idiopathic means we've looked, but we can't find a cause, so we don't know, right? And again, that's the most common form of epilepsy that we see in our furry critters, right? So I'm going to hit a little hyperlink to that too, because I want you to kind of know what would qualify a dog or even a cat to even be considered as a possible idiopathic epileptic, right? So there's 4 criteria that I want the audience to know that would make you at least be highly suspicious that this is what we're dealing with. Okay, so number one, idiopathic epilepsy can be considered if seizures are present in a breed of dogs, say, that is known to have genetic epilepsy. So I'll give you an example of these breeds. There's no less than 26 of them that have been cited, right? So herding breeds are the most common, whether we're talking about Australian Shepherds, which are number one worldwide in terms of epilepsy prevalence, Border Collies, and we've got the German Shepherds, we've got Shelties and whatnot. From there, Golden Retrievers, Beagles, Kazons, we have St. Bernards, Poodles, Vizslas. So a lot of different breeds. We used to think that the longer their nose, the more likely that they probably can develop genetic epilepsy. But we are seeing the smaller smash-faced breeds like French Bulldogs and whatnot actually having familial epilepsy as well too. So that's criteria number one. You've got to be the right breed. Okay. Number two, the first seizure that you have, so the age of onset of this seizure should be within 6 months to 6 years of age. Okay. And I'll explain that a little bit because it seems a little bit odd or unintuitive. If you're less than 6 months of age as a dog, there's a higher likelihood that there's something else going on, right? And so, say, for example, you have low blood sugar that's prevalent in toy breed dogs, small little dogs have underdeveloped liver function at that point, right?
Yeah.
Or maybe being born with a congenital malformation. So that means being born with a brain that's malformed, maldeveloped. Right?
Hydrocephalus.
Fluid-filled brain, correct. As opposed to the dogs that are older than 6 years of age, and those dogs tend to have other diseases that they acquire, as opposed to it being a genetic epileptic state, right? So we just talked about brain tumors, strokes, those types of things. Okay, so that's criteria number two. We've got two more to go. So criteria number three, in terms of the criteria that we use to be highly suspicious of genetic epilepsy or idiopathic epilepsy, would be that, remember, there's nothing structurally wrong with your brain. Your MRI scan would look normal, but functionally or chemically, it's imbalanced and more pre-wired to fire. So everybody on this podcast right now, everybody has the ability to have a seizure, but our brain chemistry is such that we don't. We're well balanced. But chemically speaking, if genetically we're predisposed to having seizures, then that would mean when we have our seizure, it's dramatic. We have our convulsion. We get over it. And until we have our next seizure, we're back to who we are. We have a normal personality, normal engagement, normal dreams, normal function. So same is true for pets. So if your dog has a seizure, recovers from it, they have this little post-ictal phase, which is post-seizure, where they act a little bit abnormal. But once you're done with that, your dog should be acting normally, behaving normally. And if I did an exam, a spot check exam between seizures, there should be no deficits, no problems on my exam that I pick up. Okay. And that would say, okay, there's probably a genetic basis to this seizure disorder, as opposed to, say, if you had, getting back to the whole example of liver failure, if you have liver failure going on that's leading to toxins, causing seizures in your brain, you're probably not going to be acting normal between seizures, if that makes sense. Okay, so criteria number, oh my gosh, sure. Criteria number 4, and this is basically what you alluded to. The slam dunk is, once you go through those first 3 criteria, if you do all those tests, right? And the testing, again, simple blood test, maybe $500. An MRI plus spinal tap, depending on where you are, I mean, that could be $4,000 or $5,000. But say you do all those tests and everything comes back normal, boom, period at the end of that sentence. We've just fulfilled all 4 criteria to be considered an idiopathic epileptic.
Okay. So talk to us about treatment then. So
Sure.
I've done this workup. My dog is idiopathic, epileptic. Now what am I going to treat my dog with? And
Sure.
what is the success rate? Or cat.
Yeah. So just to clarify on that, cats can be idiopathic epileptics as well too. It's a much smaller percentage of them. So we're talking about maybe 33% of cats that have recurrent seizures can have an idiopathic form of epilepsy, whereas in dogs, the vast majority of them are idiopathic epileptic. So let's talk about treatment. Just because you have one seizure, right? So say your dog has an unprovoked, spontaneous, sudden seizure, doesn't mean that you have to start treatment right away, okay? That's important to know. In essence, the reason why is because you have to eventually strike a balance. If you treat a pet, if you treat any patient for any disease, there's pros and cons with that. Of course, by treating them, you're trying to minimize these seizures. But by treating them, there could be side effects from the medications itself, the cost of the drug, the repeat vet visits, right? The monitoring that's needed to make sure that things are going well. So the time to administer the medication. If I told you, hey, Terry, I'm going to need you to give this medication that's going to help your dog with his seizures, and you're going to need to give it every hour on the hour.
Every day for the rest of his
for
life.
the rest of his life, right?
Most owners are going to go, wow,
Yeah.
that's not going to work.
But and fortunately, we're not there with those types of drugs, but there are certain medications that are 3 times a day.
Which is tough when people work away from home and they're not even with their dogs in the middle of the day.
I wouldn't be able to do it.
Yeah.
So, I think in terms of making that decision of when to start those treatments, here are some really good, I guess I could say, criteria for us to say, this makes sense that we should start seizure therapy, right? So seizure treatment, the gold standard of it is still based on anti-epileptic drugs. Okay, so these are medications that are designed to help suppress seizure activity. Right. I'm going to call them AEDs as an acronym just because it's much shorter to say. So AEDs are medications, again, used to help suppress seizure activity. Yeah. That's still what I would, or most neurologists use to treat these seizures. And if you look at the efficacy of treating the average dog, the average cat with AEDs, 75% of pets can be treated very effectively with good quality of life, lifelong, with minimal side effects on one drug alone.
Ooh, and they're going to live a normal lifespan.
Correct.
Oh, awesome.
Yeah. Okay. Now, that's not always guaranteed. It means that every time I say 75%, it means 25% of pets might be considered refractory epileptic.
Non-responders.
Yeah. So those are the ones that you're doing the best you can. You're doing the follow-up visits. You're checking drug levels to make sure the AEDs are in the right range and whatnot. And yet, they're problematic. These are problem child dogs. And so, and a good example, notorious, German Shepherds can be non-responders. There's something about that breed that can make them much more difficult and challenging to treat. And so then, as soon as you're on, 2 drugs or more, I mean, you are definitely in that non-responder category. And it doesn't mean that all hope is lost. But certainly that's where you have to start getting a little bit more creative and maybe adding on 2 drugs together. So we know about this concept in biology called synergism.
Yeah.
1 + 1 = 3, right? And so the math behind it is that 1 drug alone plus another, 1 drug alone is not effective as 2 drugs together, right? Yeah. And so,
especially if they have a different mechanism of action, but they're coming out soon.
Correct. That's a great point. Thanks for bringing that up. And so I would say that overall, I know it's dramatic. I know it's hard when your pet has seizures. It's scary. It's disruptive. But the reality is we see a lot of pets do really well, right? But it does take teamwork. You can't do it alone. You should be obviously having a very good relationship with your veterinarian and doing the follow-up therapy as well too. So that means monitoring, making sure that the lab work that you're doing routinely is showing that your pet is not having very bad internal side effects with these medications.
Got it. I got it. Because some of these medications can actually harm the kidneys or harm the liver. So, it's a game that we play, trying to make sure we have the right dose, but we're not doing any harm. So, so tell us about some of those drugs that you would, what's the first drug that, well, actually, let me back up. Because I have a feeling most people out there are going, well, my veterinarian doesn't have an MRI. My veterinarian wouldn't be able to do this workup. So a general practitioner can manage. I'm sure they're very good at managing a seizure dog. But if people have an option to get referred to a specialist like you should, people, I'm just telling you, do that, because your general veterinarian is not going to have the same knowledge or the same sophisticated imaging to really make these diagnoses. So I'm sorry, I'm putting a plug in for you, but I think it's really important. I would, beyond a shadow of a doubt, the first thing I would do if my dog was diagnosed with a seizure is I would find a board certified neurologist that I could take my dog to. And I would get referred, obviously, from my veterinarian.
I think that's a really, really good point, right? Because, know thy enemy. It's really important to know what's causing it, if at all possible. And then, of course, you then get to benefit from the added expertise and experience that a boarded neurologist has in the matter. And so, but I get it. Listen, this is real life, and we don't have neurologists everywhere in every demographic. And there are times, many times, even myself, where, hey, if it looks like a duck and walks like a duck, and we've fulfilled all 4 criteria of idiopathic epilepsy, I can make that assumption. And there'll be hints down the road that I might be wrong, right? So again, if, say, a pet was doing well, but all of a sudden now the seizures are changing in a different way, or they're acting abnormal between the seizures, these are all clues that maybe something else is going on. Right? So I think that's an important
fact. So at that point, if you hadn't done imaging, you would definitely want to do imaging, because you would be looking for things like brain tumor or something else. Yeah, I get that. Yeah, it makes a lot of sense. So medication-wise, what's your number one go-to?
Yeah, so the number one go-to when it comes to AEDs or anti-epileptic drugs, the number one drug, and this has been shown in studies again and again, is phenobarbital. So phenobarbital is a barbiturate, so it's going to have sedative effects, it's going to have side effects. But long story endured, it's a drug that's been shown to be highly effective in suppressing seizure activity in spite of the cause, right? And so that would be one of them. Now, remember, every drug that I come up with, it's going to be important that you realize there's going to be a side effects that all pets will show, but most of them acclimate to it. That means they get used to it. Okay. A lot of these side effects will actually decrease with time. And so, example, hey, if we're asking the brain activity to lessen, then sedation will be one of the side effects that you see.
Okay.
Right? And just because you see that early on after starting the medication, don't just say 1-800 bad drug and stop the medication. I think it makes sense to say, okay, within 2 to 3 weeks, my veterinary neurologist told me that things will get better, and by and large, it does.
Okay. So be patient, people. Yep. If you give your dog or a cat some time to respond.
Absolutely.
And dogs and cats, both?
Correct. I mean, dogs tend to be more susceptible to things like drinking more and therefore peeing more and those types of things. But all of the species on phenobarbital, including people, can have some form of sedation. Okay. Yeah. So phenobarbital would probably be considered the most common one. Another drug that is probably along the same level, but it's kind of a newer drug that got off patent, I think, in 2006, meaning it became much more affordable, is a drug called Levetiracetam. And that's a mouthful, but so most people call it by its trade name, Keppra, Keppra. So Keppra, very common and widely used anti-epileptic drug. It's probably number one in people. And the reason being, Keppra is incredibly safe. And so even overdoses of it would be very difficult to hurt a patient on it. Number two, the sedation profile that you see on it tends to be much less. And if you see it, a lot of people that are on Keppra acclimate to it a lot quicker as well too.
Mm-hmm.
Yeah.
So actually, so a personal story, I've lost him now, but I had a 13-year-old Labrador, and he had some seizures. Rainier worked him up for us, didn't have a brain tumor. We thought it was idiopathic, and he was on Keppra and did really well. I think he only had 2 seizures.
That's great.
Yeah. And not a lot of sedation.
Oh, that's
You're
good.
right, so.
And annoyingly with Keppra, when it first came out, when they studied the so-called pharmacokinetics, so basically how the drug affects the body and how the body affects the drug, we realized, son of a gun, we have to give this medication every 8 hours. So that means morning, afternoon, right before you go to bed, right? So whether it's a 7-3-10 schedule, 8-4 midnight schedule. And so a version of it came out that's the extended release version.
Oh, nice.
All right. Yeah. So sustained release. And so we see that with other medications like omeprazole or whatnot. So it's more convenient, morning and night, so twice a day. The problem with that is that it's only extended release because of the film or the coating around the actual capsule. So you can't break the pill. Right. You can't dose it just that you have to give a half pill, because by breaking the capsule, it's no longer
you lose that
release.
extended release. Yeah.
But it is much more convenient.
Yeah. Oh, interesting. So, yeah, Rain, you know that we have a company and we sell CBD. And the literature that I have read, and actually our experience with our clients, is that CBD can be fairly effective for seizures. You want to talk about CBD?
Yeah, I'd love to, and I'd like to do it brazenly and openly, only because there's been so much drama surrounding CBD. So we know that it's had an immense recent popularity in terms of interest. And oftentimes when you really think about CBDs as a compound, and so, CBD, we're talking about cannabinoids, and these are all compounds that come from the cannabis sativa plant, right? And so CBD is how we shorten it. But there was a lot of popularity, and it stemmed from actually Colorado Springs, where I'm from, where Charlotte had Dravet syndrome, and this young girl, unfortunately, was having up to 120 seizures a day, right? And by using traditional modern Western medicine, I mean, she was failing all kinds of drug protocols. And so, as we talk about anti-epileptic drugs, there's not 1,000 of them, right? In the end, even through combination therapy and diet manipulation, she was really suffering. And it was leading to a major impact on her health and her social welfare. And from there, it was her parents that took matters into their own hands. They actually had moved to Colorado Springs.
They moved from, I think, New Jersey to Colorado to get her treated.
Yeah. And I think it was a formulation by the Stanley brothers. I'm not exactly sure, but I do remember that when CBD was used on Charlotte, it was dramatic. The effect was dramatic.
So I'm just going to step in here for a second and say the part of the reason it took a while is they wanted a strain of cannabis that didn't have a lot of THC in it, because she was very young at the time that they were treating. And so they were trying to get, so irregardless of the plant makes different cannabinoids, and THC is just one of them, and CBD is another, and there are probably 140 or more other cannabinoids in the plant. But they wanted a plant that was higher in CBD and not high in THC, and that's because she was a young child. Obviously, they didn't want her high. So go ahead. I just wanted to say
that's great. I'm glad you plugged that in there, because that's important. And the THC component is the psychoactive component. That's the part that makes you high, right? And so when you think about the studies that are now starting to come out, finally we're having some hard science that's showing the benefit of CBD in its anti-epileptic effect, right? That didn't exist for a long time. And you can't just use experimental mouse models to say, I think it's going to work. I think the bigger trip up really has been litigious. It's been, legally speaking, how we look at these products and how they were probably improperly categorized by the Controlled Substance Act to a Schedule 1 substance, one that has a very high affinity for addiction and whatnot, right?
And no medical use.
And
that's the important part. It was classified as a drug, marijuana in general, as a drug that had no medical use.
And with that, then, we have this massive fanatic interest after seeing, Charlotte's dramatic recovery. So the idea of CBD and its efficacy as an anti-epileptic, I think one of the main hurdles has been trying to perform these strong studies and experimentation while the legal aspects has lagged behind, right?
Yes,
So we
absolutely.
certainly see that. But with that in mind, it was, I think, the AKC Foundation that funded a very strong series of studies. And those were run by a good friend of mine and former resident mate, Dr. Stephanie McGrath at, of course, Colorado State University.
Yeah.
And she has two studies. That one of them was a smaller one, the other one was a crossover study, but showed double-blinded, controlled. There was a placebo. This is
a well-done study.
A well-done study, right?
Yep.
And basically showed strong evidence that the dogs that were treated with this particular form of CBD had much lower amounts of seizures than those that weren't, right? And so on the order of maybe 30%. And that doesn't sound like a lot to a lot of people, but I will guarantee you that is a tangible difference.
That's
right?
a lot.
Yeah.
And we might add that, we didn't know when we first started using CBD in dogs, we didn't really know how to dose it. For osteoarthritis, I think most people have settled on 2 milligrams per kilogram. But every dog varies. Every dog absorbs it differently. So you do have to play around with the dose. For seizures, what I have gathered both from the animals that we've treated and from the literature is that you have to go with a higher dose. And I want that out there because if a lot of people are trying to treat seizures with CBD in dogs and they're using too low of a dose, they're not going to get the effect. I personally don't think you can overdose CBD if it doesn't have THC in it. Now that is a big deal. Whatever product you get, make sure that it has little or no THC because dogs are much more sensitive. They have more receptors for THC than people do. So they're going to have adverse effects from it that a person might not have with a very similar dose.
Yeah.
So you are going to have to probably go up higher than you would if you were trying to treat osteoarthritis. But it's okay as long as you don't have a lot of THC in the product.
Sure. And that's one of the things that Dr. McGrath found out in her study as well, too, is that the dogs that tended to be responders actually had higher levels of the CBD in their blood, right? And so from there's still a lot of questions we have to answer. What is the optimal dose for CBD in dogs? What is the optimal dosing schedule for it? What's the long-term safety? And she found out that the short-term safety, most dogs did really well with it. Some dogs developed a little bit of sedation that was transient.
Yeah.
There were dogs that developed some gastrointestinal signs like either vomiting or diarrhea. But from there, by and large, very, very safe.
Yeah.
Right?
And honestly, the vomiting and diarrhea, I think a lot of times it's not caused by the cannabinoids. It's caused by whatever the cannabinoids are in. So it's the oil. In many of these, if you're giving an elixir and you have to give a really high dose, the oil may give them diarrhea.
Right.
So you do want to be, but I don't think it's the CBD that's causing it.
Yeah, so I think it's intriguing. I think there's many more miles to go, but am I optimistic about the use of CBD? Absolutely, I am. It's tough right now for me to name a particular product, a particular dose. But when you're going out there, there are definitely products that are different from others. Looking for a certificate of analysis or COA, super important. Right?
Yeah.
So
So
I'm
going to
probably preaching to the choir.
Well, I'm going to expand on that just because I don't know that most people would know what a COA is. So it's a certificate of analysis, and it's really important when you're looking at a cannabis product because the plant is what we call a soil remediator. It will pull anything out of the soil. So if you plant cannabis plants in an area that, say, maybe had tobacco grown in it, there were a lot of pesticides used, that's what you're going to get. And it actually concentrates in the flower, which is what we use to make these products. So you do want to get a COA because they're going to tell you exactly what's in the product. So there have been studies where people have pulled products, pet CBD products off the shelf and tested them. And 70% of them do not meet their label claims, which means that some of them actually don't have any CBD in them. Some of them have way more than they say. Some of them have way more THC than they claim to have on the label. But a certificate of analysis done by a third party should tell you exactly what is in the product and whether there's anything heavy metals, pesticides, other things that you need to be concerned about. So I would never buy a product that didn't have a COA on it. And so that's important.
Do you mind if I comment on just a couple of additional things that's kind of interesting about the treatment, the overall treatment of epilepsy? So there's been a lot of interest in diets, whether or not diet manipulation can help, because in certain forms of epilepsy in people, the ketogenic diet was one that showed some promise.
Right.
Unfortunately, there were studies that have been done on the veterinary side that showed that the standard ketogenic diet did not significantly improve seizure control. The same was actually surprisingly true for omega-3 fatty acids, so DHA, EPA, that in that one study didn't show a significant difference in those that had received it and those that were not supplemented. That doesn't mean that omega-3 fatty acids isn't good for you, right? It just meant that in the way that study was designed, that the overall effect didn't show a change in the seizure frequency. Medium chain triglycerides, or MCTs, did. So there was a pretty big study done in Europe, and through that came Purina's prescription diet called Purina NeuroCare, which was high in medium chain triglycerides, which is actually really just a different version of trying to do a ketogenic diet, to be honest with you. But the point is, right now, not a lot of data showing that specific diets will make a massive change in seizure management. But I think it's just important for us to put that out there.
And I was just thinking something too. You mentioned, so the seizure studies, I think the longest one was like 3 months. Is that right?
Mm-hmm. Yeah.
So there is a longer study out there. It wasn't dogs with seizures, but they treated dogs for, I think, 6 months and didn't see any harmful effects. So while we don't have multiple year studies, we do have a fairly long study, a 6-month study that doesn't show any harm. So one of the concerns when we first started giving CBD to dogs and cats was that we saw an elevation in some of their liver enzymes. We now believe that that's not because we're damaging the liver with it, but it's activating. And so these enzymes are being released. So most people don't believe it causes any harm.
Yeah, I'd agree with that.
What else? What do people need to know that we have not told them about epilepsy or seizures? Sean, what are we missing here?
It was a very informative conversation for me. I felt like I got a lot of very good key points to keep an eye out for. I personally have a mini Australian Shepherd.
I was going to tell you that when you said it. Yeah. Don's got a mini Aussie.
So she's 4, so she's not out of the woods yet. But it's I think that the information was fantastic across the board. The one question that came to my mind was, if I'm as a pet owner and with a newborn child as well. Thinking about the $5,000 costs of the spinal tap and the MRI. If my dog has one seizure, does it make sense to start with a CBD product that doesn't really have those side effects, instead of going for, a $5,000 workup? Maybe that first initial visit with my general veterinarian without going to the specialist, and seeing if we can either control it or just give the dog CBD at $50 a month or whatever it is, relative to $5,000 when you might be going back to CBD anyway. So I'm just curious on your thoughts there.
Yeah, so Sean, and that actually reminds me that this should have been, I should have segued to this point. So there's a couple things I want to say. So as Terry and I talked a lot about CBD and what's been done recently and the promise, it's really important to know that CBD was never given to any of these dogs in the study as a solo product. This is all in addition to anti-epileptic. They're all on some form of standard maintenance anti-epileptic drug therapy, right? So it was an adjunct, meaning you added on, and 1 + 1 = 3. Okay, so that's an important fact. From there, you brought up another good point about, say your mini Aussie Shepherd has a seizure. Say you forego the very expensive testing that would be helpful. But again, like I said, not every pet needs to have it. If it looks like a duck and walks like a duck, we can move on from there. So let's talk about a few criteria that's important for our audience to know that would make me say, okay, I think we really need to do this. So seizure frequency is super important. Again, if you have just one seizure or rare seizures, that's not worth treating lifelong, right? So the ACVIM consensus statement, that's my organizational body that helps come up with guidelines. They would say that, hey, if you're having more than 2 seizures within a 6-month period of time, it probably makes sense to initiate therapy. And we learn that because in people, the more seizures you have and the younger you start, the more the hardwiring of the brain changes with time, and neurons that fire together wire together. That means that you're more predisposed to having more seizures. So when it hits a certain threshold of frequency of seizures, it makes sense to start. But again, one-off isolated seizures, 1 every 6 months, that is not an indication to start. Okay. Another example would be, okay, well, let's push that a little bit. Say you have a dog and his first seizure would be 2 seizures within a 24-hour period. There's actually a name for that. That's called a cluster seizure, right? And so cluster seizures are dangerous because seizures beget more seizures, just like what we were talking about. So as soon as my dog has, say, a cluster seizure, from the outset, I'm not going to wait 6 months to figure out if they have another one. I'm going to say, well, that's kind of a dangerous situation that could spiral out of control while I'm not home and whatnot. I would probably recommend starting therapy on that pet. Here's another example, the severity of the seizure, right? So say it was maybe only 1 seizure a year, but boy, when he has that seizure, he goes big. He has a 30-minute long seizure, which is like a status epilepticus, and something that's very, very life-threatening, one that you would absolutely rush your pet. Any seizure that lasts longer than 5 minutes at home, there's a chance that it's not going to stop. You definitely want to get to an emergency facility ASAP, not wait the next morning. So, that severity would certainly justify starting seizure therapy ASAP, right? So that's another example. And then finally, I've had clients that look at me and say, hey, listen, I really don't like these seizures. I know they're rare, they're not that frequent, but
they really bother me.
It really bothers me. Can we agree to start therapy? And so absolutely. Remember, this is a relationship that you're developing. A veterinary client-patient relationship implies that they're being heard, that you're listening to them. So I would feel that that would be yet another factor. Conversely, the clients that say, well, listen, I mean, based off of your criteria, I should start Fluffy on an anti-epileptic drug and whatnot, but I really don't want to. I'm really worried about this. I'd really like to give it a little bit more time. Hey, listen, we all need to listen to, our audience. We need to listen to them and to figure out what's the best plan and craft for that particular patient. Okay.
Yeah, I love that. So let's summarize a bit because you said some really important things. So that if your dog or cat has its first seizure, then you might try to wake it up. If it doesn't wake up, it's seizuring. You may know that anyhow, so you may not even need to go through that wake up stage. If it lasts longer than 5 minutes, you're going to take them into an emergency clinic. It could be tough these days. Hard to get into emergency clinics in veterinary medicine right now, but you're going to do that. You're going to get them in because after 5 minutes, they may just continue to have seizures.
Yeah. And in 30 minutes, it's been shown in people and in dogs and in cats, you can have permanent brain damage.
Okay. And then I wasn't aware. I thought that was really interesting that seizures sort of beget seizures. So the more seizures you have, the more hardwired it becomes, the more you're going to have, which does, give credence to why you would treat. If you've had a couple in 6 months, that makes a lot of sense. So great. This has been great information. Hopefully, any of our audience that have animals that have had a seizure or epileptic have learned something from this. Rain, if people don't have a neurologist available, they live hours away from a board certified neurologist. What can they do? Is there telemedicine where they can call in and if they videoed, have somebody look at it, or what are their options if going to a board certified neurologist just out of the question?
Yeah. I mean, hopefully, everyone's at a place where at least they have access to their general practice veterinarian. I think that's the most important thing. And as a DVM, which is our veterinary degree, any veterinarian should be in good measure to be able to help. Right. So that's important. And I do understand that access to specialty care is not easy. I think COVID has helped change a lot with respect to trying to provide telemed as an option, right? That still has a way to go, especially when we're talking about potentially prescribing anti-epileptic drugs that could be controlled substances as well, too. Yeah. There's a lot of litigious things that will go into that. But, the short version of it is that, the vast majority of veterinarians know how to deal with seizures. They know how to manage them. They know how to monitor them.
Great. So people are going to be able to get care. That's awesome. I cannot thank you enough for coming on. I think this has been very valuable. Sean, did you have anything else that you wanted to ask or add?
The only thing that so I take all the customer service calls for Dr. Fossum's Pet Care, and we have we've seen a ton of success stories coming in regarding the seizures. Now we can't make any. You'll never see anything about seizures on our website except for reviews, the customer-driven reviews that they'll say my dog hasn't had a seizure since I started 78 days ago, for example. Just about most clients that we see, I hear phenobarbital all the time. I hear Keppra all the time. I'm just curious of what your thoughts are around the potential side effects of those phenobarbital and Keppra on other organs, if any at all, and then if there's any. I have a lot of customers coming in asking the question, can I reduce, not necessarily eliminate them from the medication that I'm giving my dog, but reduce the amount that I'm giving my dog and then increasing or just keeping them on that CBD regimen. So I'm just kind of curious about
decrease.
I'm just wondering your thought about that relationship and how you handle those situations.
Yeah, sure. So let me start off by answering the first question with respect to, you hear about phenobarbital and Keppra and potentially other medications like bromide or whatnot. And so, an important thing to clarify and to state is that by and large, these drugs are usually very well tolerated by pets, right? We talked about the side effects that are expected and acceptable and likely will dissipate or at least improve with time. Of course, when it comes to phenobarbital, the bad rap that it gets is because it is liver metabolized. And in a small percentage of dogs, it can lead to liver problems. And if left unchecked, can eventually lead to liver failure, right? Mm-hmm. And so this is an important thing. There's a lot of propaganda that it's a very, very bad drug. But remember, just like CBD, I mean, these are medications that affect the liver, and the liver affects the medication as well, too. So I just want to start off by stating that I think people have certainly overstated the dangers of phenobarbital, right? That's the first thing. But that being said, because there are risks associated with it, it's by establishing care with a veterinarian that's willing to make sure that the liver is doing well by routine lab work and whatnot, that then any of this needless sense of worry can be dissipated. I think that's a very, very important thing. So from there, you had mentioned, okay, well, we're on, say, what I call maintenance AEDs or maintenance anti-epileptic drugs. So say you're on phenobarbital. We've been hopping along well with that. You know what you're expecting with your pet on this medication now, both in terms of efficacy and tolerability. And then you add on, say, a product like CBD. Well, the first thing that you do is you give it enough time to see what the efficacy would be with those two medications. And there will come a certain point that if you're pleased with what you see, I mean, I can't give medical advice for every single patient that is in this specific situation, but I would say it would make sense to say, well, wait a minute. Wouldn't it be nice to see whether or not we can decrease the dose, the dose of the other medication, say phenobarbital, by say a meager 25%? And it has to be some either 25, 50, or 75%. It's got to be something that's a divisible pill, right? So decrease it by 25% might be the way to go. I wouldn't stop it all of a sudden. I think that is definitely tempting fate. But you do it slowly as well, too. Right? So meaning, if you're going to wean down one of the other medications in the hopes that, of course, you don't lose the seizure control that you just gained, then dropping it by, say, an increment of 25%, and then waiting again at least a month to see what the effects would be, before then you try to decrease it yet again. And as soon as you find out, son of a gun, I dropped it too much, then you probably found your sweet spot. And that's the art of seizure management, not the science of seizure management.
And I should mention that our default is please speak to your veterinarian. That is always the default. We're not giving, oh yeah, you should remove this. That is never ever the case, right? I want to make that very clear. But and a lot of it's client driven. Like, do you think that I can get rid of this other medication? And it's please go speak to your veterinarian. But we just hear some of these success stories of that happening, and it's not just on the seizure side. It's actually on other ailments that pets are dealing with as well. But
we have one girl who lives, I think, here in Phoenix, right? That we did one of those fireplace chats with. She has a cat seizure. She works in a grocery store. She really can't afford a product. But it has made such a difference. Her cat essentially has stopped seizuring on it. So we struggle. But
it was it was truly an incredible success story of seeing, a young lady putting kind of her own well-being, putting her cat's well-being above her own to a certain extent. And but she's such an incredible lady, and what an amazing success story to see the success that she's seeing with her cat. So really, really cool stuff. Yes, I just wanted to say thank you to Dr. Ko for joining the Cutting Edge Vet Pet Podcast. I feel like I've gained so much knowledge today listening to you speak about this. I can only imagine what other pet owners think that are actually dealing with this in real time. So, and the last thing I'll say is a lot of pet owners are just looking for that confirmation from a third party on whatever they're dealing with. They just want to hear something from somebody who doesn't have any skin in the game, that to kind of drive them in the right direction. And I have a knee surgery, but I went in for ACL surgery one time, and they thought I had a torn ACL, and I went in for full ACL reconstruction, and they came out and they said, "Hey, your knee's fine." And and the thought there was surgeons are just going to do surgery, right? And they're gonna if you have an ACL, they're going to cut regardless. And thank goodness I had a high quality surgeon that didn't do that. But it's always good just to get that second opinion, or that knowledge base that you've just delivered to everybody. So
you're very welcome.
So thank you so much.
You're welcome, and you always hope that your healthcare provider has a northward facing, moral compass. But yeah, this was my absolute pleasure.